Now, what are the potential savings? Well, potential savings are enormous. We're already seeing that in the marketplace. We're seeing trends that are anywhere from 5 to 7% lower than the trends that would otherwise exist in healthcare. And you multiply that over several years, we're seeing enormous changes in healthcare costs. And it's not from healthcare cost shifting, it's from behavioral changes. And we're really not into the second generation to fully experience the saving potential of this new approach. The chart that I've shown here for potential savings shows that depending upon the number of programs that you're giving out as options and choices for behavioral change and wellness and disease management, all those options, they'll have a different impact potentially on what your employee costs are, what your employee choices are that you're giving out as options for them. And then how aggressive are you promoting those options? If it's passive, you're going to get some changes because you now have a few more choices and options out there, but you don't get very much savings. You can see some very, on the left-hand side, without getting into the full definitions, if you just have some basic programs available, traditional plans, and you passively put the information out there, but it's stuff that people haven't had before, you'll get some savings, maybe 2% savings. But as you move into first and second generation models where you're encouraging and rewarding information, decision support tools are available, that you're really making headway on behavioral change and engagement and empowering of the individual financially and with information, you can see that the changes in cost are getting better. As much as 15 to 20% in a good second generation product of healthcare consumerism. And you can see on the far right hand side I've had third generation and future, because it's not just the healthcare costs at that point that are being saved, but it's other costs in corporate productivity and absenteeism and other corporate expenses that can accumulate. And there we're showing more than 20%. These are not made up numbers. These are very realistic relative to the marketplace and the experience that we're seeing out there. And there are studies, again, that we'll make available through the center that relate to many of the carrier studies and other independent studies that are being done on the cost savings of these type approaches. As we move into the future, the bottom line shows us that it will develop new ideas, things that we can't even think about today. Approaches to services, online services, capabilities to reinforce behavioral change. We'll get better at understanding what motivates people and how they can make changes. Online fitness activities, all sorts of new things that can come out that we can't even imagine once we unleash the power of the consumer to actually get involved and to demand new products and services. So you can see here from a passive approach, some of these expanded from 5% up to as much as a 30% savings. We believe these are really out there to be had. They are realistic, and we're seeing the marketplace develop the products and services to actually deliver on these savings.